I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to our Tuesday night Facebook Live event. So over the past several weeks, we've really gotten a lot of questions and interest and curiosity about how the COVID crisis and the quarantine has really affected not only our practice, but plastic surgery in general. So Ella and I were actually interviewed by the Pittsburgh Post-Gazette last week regarding this topic. So we figured it was such an interesting topic, we figured that if you didn't see that article, you may have some interest. So we thought we would spend tonight talking about, at least the start of it, about what our practice is like now, what we're seeing, and we invite you to be a part of that. So if you have any questions, please type them in. We can go over some different procedures as well and give you some information about those. But you know, when at the end of last year, end of 2019, we get into 2020, our practice was actually doing well. We had a steady influx of new patients. We were busy in the operating room. The spa was busy. So there was no sort of clear-cut issues that we were aware of that were going to be a problem. And then all of a sudden, COVID came into all of our lives, and by the middle of March, we had the shutdown. So the surgical practice was actually shut down for about 6 weeks. The spa was completely shut down for about 8 to 9 weeks. So for a while, everything was just dead in the water. Ella and I spent a lot of time going through the practice, looking about, you know, sort of where the practice was going. Did we want to change direction? So we used that time constructively. We were also on a lot of calls with other plastic surgeons across the country, different groups as far as Allergan, the American Board of Plastic Surgery, the Aesthetic Society, and talking to other plastic surgeons about what they were doing and what they were seeing. So a lot of it was really trying to change our safety parameters, but also what we thought was going to happen when we were able to finally open our doors. And there were really two schools of thought. Some of us thought that, you know, we may not see the influx of patients and that may be a very slow return. Others thought that we would sort of return to some type of normalcy pretty quickly. So by the middle of May, when we opened our doors, what we found is a pretty good influx of patients. So a couple of months later, we're still seeing a very steady rise and influx of new patients every week. So the problem for us was that how do you accommodate the new sets or the amount of patients that we're seeing with also the restrictions of keeping everybody safe, not having people in the waiting room, really kind of staggering how people are seen in the office. So what we've done is actually extended the office hours. So we're starting a little bit earlier, we're going a little bit later. The surgery centers, the surgery center we use has accommodated us, allowing us to work a little bit later also to accommodate the patients that had to be rescheduled, plus the influx of patients that we're seeing now. So one of the questions that we are asked is, what types of patients are we seeing now? Has it changed the sort of what people are looking for? I think there was this idea that with the amount of Zoom calls that are being done for how people handle their businesses across their own business, across the states and the country and also the world, that we would have an influx of patients looking at basically the signs of aging. So what we've seen is just a moderate amount of patients coming in with signs of aging. We have seen patients coming in for Botox and dermal fillers. I've seen a lot of patients coming in for non-invasive procedures such as our CO2 laser, our new Virtue, which is the radiofrequency microneedling machine that we have now. So we've seen an influx of that. What we've really seen a big increase is female patients, the ages of 19 to 25. They're mostly coming in for two areas. One, a breast augmentation. The other one is submental liposuction. So a lot of this area here where they've noticed it over the past few years, and now that it really has taken the time of the working from home to really take care of these things. So we're seeing a lot of younger patients coming into the practice now. The other areas that we're seeing, again, not so much. We're seeing a moderate increase in the amount of facial surgery that I'm doing, but we're seeing a big increase in body contouring. So breast augmentation leads the list. That was always one of our #1 procedures, but now it is really jumped in the amount of cases that I'm doing. We're seeing a lot more augmentation and breast lifts together, mommy makeovers, liposuction. So a lot of these in both men and women, but really a lot more women coming in to talk about it. When I asked them why now, a lot of them have been thinking about it for a number of years. They were at work, they didn't have time to even come in for a consultation. So I think patients that are now working from home, kids are off from school, so they're not having to run kids around for activities and different practices for sporting events. Now I think they're having the time to really explore those areas that have bothered them for several years. So we're seeing a lot of patients coming in for consultation. My philosophy for consultations has always been about education. So I really try to make it not a sales event. That's why I do a lot more, even now, more face-to-face. We were doing a lot of virtual consultations, at least to get the ball rolling several weeks ago and a couple of months ago. We're really back to seeing a lot of face-to-face patients. I like face-to-face better. I think I bond better with patients. I think we can actually establish a better rapport. And I think patients are more comfortable and they want to ask questions and they want to take the time to have me go through things a little bit more in depth and talk to them about it. So we really want to make sure that patients know there's no obligation to surgery, and we really go through the procedures and talk about it, the post-op. And so we're finding that people now are saying, okay, we can really put this into our timeline. Patients actually are also doing surgery now because they're working from home. They can get back to working from home sooner than they would have to return to the office. They can recover from home in the privacy of their own home. They're not at the workplace. You can be on a Zoom call within a couple of days of surgery. So most of what I do is not a lot of downtime, several days to a week or so. So patients have time now that they can recover, and none of their coworkers even know they've had surgery. So we've seen a good influx of surgical patients for that. Some of the questions we've also been asked is that, do we think that patients are now trying to do something because they're sitting at home and thinking about it? I think the crisis, the COVID crisis, has caused a lot of anxiety for patients. And so I think sometimes patients now, they want to do something nice for themselves, they want to divert their attention. So we are seeing patients that are coming in that want to feel better, that want to do something to make themselves feel better. So I think our surgery and also our spa services have increased because of that. One of the things we've done also through the shutdown, as I said, Ella and I have looked at the direction of the practice. We were able to open a procedure room and an aesthetic center, so we've added devices. And Fridays, we have actually now started doing some local anesthetic excisions and scar revisions and ear repairs and things in the office, as well as a lot of the lasers that we've mentioned in the past. So we've been actually really booked for that, and those Fridays are booked out now for almost 2 months. So we've had a lot of patients begin because there's no downtime. People are taking a lot of time to get their skin back together. Patients are now getting their weight under control. So they're using the shutdown as a time to sort of take care of things that have bothered them for some time.
Why do you think the younger people are coming in? Do you have any idea why we're seeing a younger group of patients at this time?
Again, I think it's younger patients. I think that there's something, again, that's been bothering them. When I talk to the ladies, especially about the augmentations and the cemental liposuction, these are things that have bothered them for 3 and 4 and 5 years. And so now they said they've had time to do it. Some of them are, again, not having to work or not going to school, so they have the time off that they can heal and not have to think about getting back to work right away, or having to go to classes and sit through classes and carry books. So I think that's why we're seeing a younger crowd. That's just my take on it.
Financially, do you think having some of the younger 20-somethings come back home during this crisis, and now they have the financial ability to do some of these procedures?
I think so. I think some of them that have moved home gives them a little bit more stability, not only for financial reasons, but also a support system. So I think, again, breast augmentation and submental liposuction were the most common things I'm seeing with the younger patients. They're a very quick turnaround, very quick back on your feet, back to exercise, back to work. So I think probably being back at home maybe has helped them a little bit with the financial capabilities.
What are some of the procedures you're seeing for skin texture, tone, rejuvenating the skin that's non-surgical?
Yeah, so again, we've had a lot of patients coming in now that have said, you know, I've always wanted to try to do something. I haven't had the time. I've been running around. So I'm at work. I just don't have the time to do things. So we are actually having patients see our specialists for skin care. Right now, we have an esthetician that's sort of on a limited basis because with the shutdown, they're not allowed to do a lot of stuff around the mouth and nose area. But we can still do skin checks and get patients on skin care. So we have skin care lines that we're starting patients on. We're really starting to see a lot of patients that have, talk about the luster of their skin, the pore size, the sun damage, and little areas of spots that have brown spots and red spots on their skin. So with the addition of our Virtue, that Virtue machine is brand new. It's the upgrade to what we had before us, the Vivace. It's microneedling and radiofrequency. We really combined that well with our CO2 laser. So the radiofrequency microneedling Virtue machine goes deeper into the dermis. The CO2 laser is a little bit more superficial. So we can treat the skin not only from deeper to try to tighten the skin, treat fine lines and wrinkles. Also, the crepiness of the skin improves with those two devices. We've also seen a much better tissue or skin tone. Pore size is also improved. The pigment areas. We also use our Aerolase laser for treating pigment, and it's still very effective. So we have a lot of different modalities now that patients are coming into to find out about. So the whole idea of the Aesthetic Center was to be able to take patients really from a very limited invasiveness to non-invasiveness and really be able to treat them for all of their needs. So we've added a really terrific hair removal or hair reduction laser, a skin wave for facials, new skincare products, the CO2 laser we've added, the Virtue as I've talked about. So we've added these devices over the course of the end of last year and the beginning of this year, and now been able to put them together and pair them up. So we've really had good success with those treatments.
You mentioned body contouring. Can you describe that a little more, what you're addressing with that?
What I mean by that is it's not facial things, so things on the body that bother people. So we've had a lot of patients that have lost weight during COVID, patients that also have struggled with maintaining their weight loss. So liposuction of what we've seen mostly of arms, back, hips, and abdomen are still very popular. We've had patients with weight loss now have excess skin. We have a lot of moms now that have a chance to come in and talk about mommy makeover. So that's a very popular, it's always been a popular combination for me, but now with the COVID, it seems like that has really increased. So moms, again, they're not having the burden of having to get kids to school and to athletic events. So they have the kids at home, they have the support system that if they wanted to have surgery. So when we talk about body contouring, we're talking about breast surgery, whether it's going to be a breast augmentation with a lift or a lift by itself, a tummy tuck, and liposuction. So those are the contouring, the body contouring. We've seen a lot of changes with ladies coming in about their arms as well. So liposuction and arm lifts are popular.
Do you feel patients are investing more in themselves since we've gone through this experience, or as we are going through this experience with quarantine?
I think so. I think patients are now using this time. They realize that how they look and feel is important to them. Not so much for whatever the people think, but they just want to feel good about themselves. I think they are investing in themselves because I think some of the things they were wanting to do. They're not being able to go on vacation. They're not being able to go out and shop like they would. So I think that they're using this internally so that they can really take the time and the energy to focus on themselves and really kind of enhance who they are and take care of some things that really have been lingering or weighing on their minds. A lot of patients will tell me they have been thinking about this for a number of years, and this has just given them the opportunity to really find out about the surgeries that they're interested in and take care of it.
Since quarantine started, what has been the most popular procedure people have been asking for, and why do you think that that is?
Again, I've seen a big rise in breast augmentation. So, and that's with any age, and that's starting at 19 all the way up into ladies in their mid-50s. Again, the breasts are the most feminizing part of a woman's body, and so it's always an area of concern for women. They want to look and feel good, and for a lot of women, that is really the big part of what their look is. Ladies now are wanting to go out. It's sunny, it's hot right now. Pools are open, so a lot of times women are coming in mostly because they've lost fullness in the upper part of their breast. And so it's that gap between the upper part of the breast and either the bra or the bathing suit that brings them in. It's something that's bothered them for years. So women today are really not looking to look augmented. They're not looking for those large breasts. They're looking for a nice shape. They're looking for fullness. They want that natural look. So again, this is why it's been such a popular choice for us. My philosophy about breast augmentation is always about a natural look, about creating balance or recreating the balance of their breast and their body. So I think women today really are looking to just fill out their clothing without having to wear a padded bra. It's an easy recovery, so most women are really not. We can get them back to their lifestyle. Seems like we're having some technical difficulties.
Some people are saying they can't hear as well,
Oh,
so
okay.
we're trying to make
I'll try to speak up.
Also, can you tell us a few of the changes that have been implemented in the office post-COVID once you started seeing patients again?
Yeah, so, we have a surgical office. So again, our consultations are really about education, but also about safety and sanitation. So we have a lot of patients coming in, they're post-surgery, they have dressings on, sometimes they have drains. So sanitation and cleanliness has always been an utmost part of our procedures and a priority for us. So what we've done is we don't use the waiting room as much, so we might have 1 or 2 patients in the waiting room. So what we try to do is stagger the way the patients are being scheduled so that patients come in and pretty much go right to the exam rooms. So that's number 1. Number 2, we're also rotating the exam room. So once a patient leaves the bed, the counters, the doorknobs, and all of the bed, we're talking about the stand, the step that allows them to get up on the table, the footrest, everything is wiped down with sanitizing wipes and sprays. We're allowing that room to sit for 5 to 10 minutes before we put another patient in the room. So we're sort of staggering the rooms to allow one room to sit. Where everybody is in a mask all the time in the office, both patients and all of our staff. We have protective gear on for all of our providers. So we are really looking to everything that we can do to allow patients to feel comfortable, to know that everything's been sanitized, and to really limit the patients crossing in front of each other, especially at the desk checking in and checking out. We're really trying to keep patients isolated so that they feel comfortable.
Do you foresee this happening in the future, like continuing this process?
Yeah, I think this is what we've gotten used to now. We've always wiped down beds. We've always, cleaned the rooms, again, because we're a surgical office. But I think just being more sensitive to it, cleaning off the countertops when patients check out, cleaning anything that would be touched, whether by staff or by patients. I hope in the future we're able to allow patients to bring in more than just one person. One thing that's changed a lot, that we've always been open to moms bringing their kids into their post-op visits, just because then they don't have to look for childcare at home. We've really limited that now. To really limit kids' exposure. Also, anything that has more patients and more people coming through the office. Again, trying to stop that crisscross of traffic. So we've really asked ladies to keep the kids at home, and they're usually allowed one person in the room with them during their consultations and post-op treatments.
So can you just again reflect on the most popular procedures that we're seeing right now?
Outside of breast augmentation, we're seeing a lot of combination procedures. So augmentations with breast lifts, tummy tucks and liposuction. We're seeing a lot of breast and belly together. So facelifts and eyelid combinations have always been popular. Again, that's a moderate increase in that, but again, I think a lot of things that we're doing now, looking at my surgery schedule not only for tomorrow and Thursday, but for the upcoming weeks, is a lot of combination procedures that we were just doing, either augmentations and or tummy tucks before. Now, mommy makeovers is almost every week, several times a week.
So would you say the consultation is the first step towards educating the patient?
Yeah, absolutely. And so, again, we are open for virtual consultations. I'm happy to do them, but I always tell patients on a virtual consultation, it does not take the place of a face-to-face. Some of my colleagues across the country are more comfortable with that. I really don't want to meet somebody at the time of surgery in a face-to-face meeting. I want to meet them before. I want patients to get a feel for me. So I'm happy to do virtual consultations to sort of get the ball rolling. I have lots of patients that come in from 4 and 5 hours away. I don't want them to have to drive 4 or 5 hours and find out it's not really what they thought it was going to be, or it's a procedure that maybe they don't want. So a virtual consultation in those cases are really good to start the ball rolling. I can look at some photographs, we can talk, we can email each other, and so they kind of have a good understanding before they get to the office. But the face-to-face is where we really go over things. I really need to look at you, look at your skin, your tissue, feel that, and find out how much elasticity. Sometimes liposuction is a better choice than a tummy tuck, but it really depends upon the tissue tone. Same thing with augmentations, facelifts. Can we get away with dermal fillers or a laser treatment versus a surgical? A lot of that really depends upon how much we see and what I see face to face. What does that tissue feel like? What is the skin? How much skin tone do you have? So it really plays a role in it. And remember, when you're doing a virtual consultation, that's a two-dimensional screen. I don't care how good the camera is. So things are flattened out. They may be you're not showing the severity of what you want to talk about in a two-dimensional. When I see you face to face, it's three-dimensional. So I like to see that beforehand. I want people to, again, see me. So, I like to size with breast augmentations. I like to show people, kind of try to show them in the mirror maybe where the incisions are, what it might look like, to give them a good idea prior to surgery, what they might look like. And I think that helps when patients plan, because a lot of patients come and say, how much change do you think I'm going to get? It's pretty difficult to have that conversation in a virtual consultation. At least it is for me. I want to be able to show them what, sort of realistically what they can expect. That way, when we get done with surgery, I have really managed their expectations before we've gotten to the OR and not afterwards. I think it allows patients to ask questions, to really think about it prior to surgery. So anyway, if you have any other questions, please let us know. We're launching something new in the practice next month, so really are excited about it. Again, this is all coming out of our downtime. We spent those 6 weeks not in surgery, obviously, so we've tried to turn our attention to things that we can offer. So we have something really big next month that we're going to offer as a practice. We've not seen anything like it anywhere across the country. So I really want you to be in tune next month, and we'll launch it. So again, we're always happy to answer any questions that you have. You can get onto our website, follow us on Facebook, Instagram, anything we can do to help answer your questions, we're happy to do.